Well, heart failure kills more people annually than some of the most common types of cancer, but congestive heart failure diagnosis is no longer a death sentence, and there are better treatments now and ways of managing it.
And we have an expert here live in studio today. Joining us is physician's assistant Linda Hricz-Borges from the Heart Care Associates of Connecticut. Welcome here to CT Style, Linda.
Hi, good morning. Thanks for having me.
No doubt. Thank you so much. So tell us what congestive heart failure is for viewers who may not be familiar.
So the heart is a muscle that pumps blood and oxygen to the organs of the body. And when the heart is not pumping as efficiently or as effectively as it should, it allows fluids to back up into different parts of the body. The body becomes congested. The lungs, the legs can be swollen, and that's what congestive heart failure is.
And what are some of the symptoms?
There's many symptoms. The more common symptoms are weight gain over very sudden, 2 to 3 pounds over the course of 1 to 2 days.
Oh, wow.
Shortness of breath.
And that's just from the fluid?
Yes, fluid starting to build up.
Okay.
Shortness of breath, that's with normal activity. Swelling in the legs or the abdomen area. Excessive fatigue. Inability to lay flat to sleep, and a cough. Those are the more common symptoms.
Okay.
So you find out that you have kind of those symptoms. Obviously this is serious. What are some of the treatment plans?
So treatment is definitely, we can be successful with treatment, for sure. I like to say that. It's kind of corny, but we could definitely be successful. The cornerstone is medications to treat the different causes. Many of the causes can be coronary artery disease, heart attacks that lead to damage to the heart muscle, diseases that infiltrate or invade the heart muscle, uncontrolled blood pressure, diabetes, obesity, sleep apnea. So taking care of all of those problems, exactly. Taking care of all of those problems, managing them is very, very important.
Okay.
Patient also, a team approach is best in managing heart failure. Patient is the most important part of that team because they really need to be on top of their symptoms, take their medications, and be in touch with their provider.
Take control of your health.
Exactly,
right?
Exactly.
Very, very important. That's one of the things that you guys do at Heart Care Associates, and we can find you online, heartcareassociates.com. Make sure you visit them today. Linda, we want to thank you so much for joining us today on CT Style.
Thank you very much.
Thanks for all the information.